Hey everybody, thanks for joining us today. This is actually funny because Amy and I, this is our second take. We did this lovely half an hour conversation and taken her time and it did not record. So we are going to re-record this again because she is just a wealth of information and very busy and a gift of her time. So we're just going to hop to it. Amy is a nurse practitioner. She works at a gastroenterology clinic. She works in a hospital primarily. She's been doing that for 19 years. And in the last year, she is a certified menopause specialist that she took testing just to help women like you and I, because there's really a need here in the Lincoln community. There's very few practitioners in Omaha, and she's only one of two. And when she signed up to take her testing last year, there's only two of you now here in Lincoln. And a lot of healthcare providers just aren't trained in this to know how to work with women in this stage of life. So I'm just grateful for her time to help answer questions. We're going to be talking about hormone replacement therapy. Last week we talked to Dr. Elton, and she works more with the functional medicine side with over-the-counter adaptogens like ashwagandha and holy basil, and she has her certificate in that. And that could be good for some women. And I actually did that route and it was helpful, but until it wasn't helpful for me. And the hormone replacement therapy has been just, for me personally, in my health journey and my menopause journey, was really helpful. And so Amy's been a friend and a colleague, and I'm grateful for your time. And sorry we have to do this a second time, but so
maybe I'll think of some new things that we didn't talk about before. And I guess to begin, Lori obviously did the introduction. I would say when we go through this menopause journey or perimenopause journey, I didn't say this last time, but I'll say it this time. There is more than one way to go through this journey. And so I did not watch Dr. Elton's presentation last week about adaptogens. But there are a lot of studies out there that many of those things work, and they help women all the time. I would not consider myself to be an expert on supplements. And if I saw a woman who came in and had a lot of questions, I would provide you the knowledge I have. But many of these things do work. There's also lifestyle modifications that work for women, whether that be sleep hygiene, diet, exercise, stress. We know all of that impacts all of us, whether we're in the perimenopause journey or not. And then there's hormones, and not every single woman needs hormones, but many women find that hormones help them because we are just giving our bodies back the hormones that we've always had, because as we age, we lose estrogen and progesterone. And so we're just giving back our bodies some of the hormone that we've lost. And so many ways in which you can do it. And I would say every single person's journey is different, and we can be flexible with your journey. Many people say, I want to just try lifestyle first. Say, great, let's try it. We can always add things. We can always take things away. There's a lot of myths out there about hormones, that hormones are not safe. I would say most of those myths are not true. There's really very few contraindications to hormones. Main one would be if you have active breast cancer, or if you have an estrogen-fed tumor that's actively being treated right now, you would not be a candidate. If you have an active blood clot or pulmonary embolism, if you've had a heart attack, and maybe you recently had a stent placed, or you had a recent stroke, those would be the main contraindications to hormone therapy. But many women think, oh, my mom had breast cancer, or I'm BRCA positive. Actually, you're still a candidate for hormone therapy. Many women think, I have migraine headaches, I have endometriosis. Those are not contraindications to hormone therapy, but how we treat you might be a little bit different than maybe the person who doesn't have any of those risk factors. So there's very few scenarios where you are absolutely not a candidate. And even if you are in that category, there's non-hormonal options, generic paroxetine or Paxil, works equally as well as estrogen does to treat hot flashes. That's a antidepressant that many people know about. There's several other SSRIs, gabapentin, clonidine. those medications, they don't work as well as estrogen, but there are other options if you're a person who does not want hormones. So for me personally, if you come to my clinic, I'm not going to force you to take hormones. I will give you options, and then we have a discussion between the two of us of where should we start with this? What do I need?
So how soon should someone start or think about hormone replacement therapy? When would maybe they want to seek you out as a provider? Like, is this an option for me? When is it too late? When I think, we talked about earlier, the earlier the better.
Yeah, so peri-menopause starts 7 to 10 years before menopause. So most women, late 30s or early 40s is when you may begin to notice some symptoms of perimenopause. There's early perimenopause, which is when you begin to notice a change in your menstrual cycle, where the cycles start occurring closer together. Then there's late perimenopause. This is when maybe you only cycle every couple of months or every 6 months, or you say, oh, I'm in menopause, it's been 6 months. Well, really, you have to go a full calendar year. That can be late perimenopause, that lasts 3 to 4 years. Menopause is just one day of our life when you've gone 365 days without a period. Average age in the US is age 51 to 52. Everything after that is postmenopause. So we think hormones are safest if we start you on them within 10 years of menopause. So that could be before menopause or after menopause. So for most women, it's a window of age 40-ish to 60-ish that you may be considered a candidate. There's some women in the low 60s that are still a candidate. Again, it's a case-by-case basis. Common symptoms women may experience that you might notice: hot flashes, night sweats, joint pain, brain fog, fatigue, mood changes, skin changes, and then there's something called genitourinary syndrome of menopause. That is recurrent urinary tract infections, vaginal dryness, painful intercourse, changes in sex drive, incontinence, waking up a lot at night to urinate. Those are all GSM symptoms. So those are all estrogen driven symptoms. So those might be some of the common symptoms you might experience and wonder, boy, could this be perimenopause?
When you put someone on hormone replacement therapy, we kind of talked about when would it be appropriate? I kind of liked it that you looked at my symptoms for me personally, and I didn't have to go through the expense of a lot of saliva tests or blood work.
Mm-hmm.
And could you kind of allude? I mean, I know with some individuals that would be appropriate, and some people you may not have to go to all this big expense because our hormones fluctuate from day to day. What could be this day of the cycle or this day of the week? It could be like a yo-yo going up and down. So
for me, I routinely do not check hormones the first time I meet you, unless if I'm wondering if you have primary ovarian insufficiency or premature menopause. This is menopause before the age of 40. I may check hormones, because if you truly are in menopause and say you're 35 years old, that's a big deal. And it's really important. We know there's studies that show that hormones help our brain and our hearts. And from a cardiovascular standpoint, those women really should be on replacement therapy in their 30s. But we would want to know that, as opposed to maybe a woman. Sometimes if women are on birth control pills, you might not know where they're at in their journey, or maybe they haven't had normal cycles for a long time, or maybe they have an IUD. Having an IUD does not necessarily mean that you're not in menopause. And so it's helpful to check hormone levels in that case. It's also helpful to check hormone levels if maybe you're having symptoms. We put you on a dose, we increase the dose, and maybe we increase the dose the second time and you're still having symptoms. Then I might be asking, well, is this really a hormone issue? Could something else be going on? Maybe she's not absorbing the hormone. So then I might check levels then. Or if you came to me and you just have osteopenia or thinning of the bones, I may check hormone levels, because we know that your estradiol or estrogen level needs to be really above about 50 in order to adequately treat our bones. And so I may check it in that case if you're not experiencing hot flashes and joint pain. Most women are experiencing other symptoms. So if you come back or tell me most of my symptoms are gone, our goal is treat your symptoms and make sure you're not experiencing side effects. And then we usually know that level is probably adequate. In perimenopause, our hormones are so volatile, it doesn't help to check hormone levels for me personally. If you came to me and said, I really just want to know my hormone levels, I could check them, but I would tell you we would have to repeat them over time to know the significance of them. And normal hormone levels does not necessarily mean you're not a candidate for hormone therapy. So I do not do saliva testing. I also do not do the Dutch testing. I don't know how to interpret those results. It's a very expensive test. It's a lot of information. If we were to check hormone levels, there's really just a handful of things I check that are really relatively inexpensive. That's how I was trained, but I know there's other providers who do it differently.
And I think, did we talk about like how long you could be on hormone replacement? You talked
so-
about that's kind of changed. That,
Yeah,
like,
it used to be that we would stop hormone therapy after a certain period of time. Now we say if you're feeling better and you feel better on hormones, we continue them. Women oftentimes experiment when they're in their 60s. They say, oh, I don't know if I need this anymore, and they start weaning themselves off of it. And sometimes symptoms come back, and then those women, we just put you back on it. The whole key is, have you had hormone exposure within 10 years of menopause? It's still safe for us to give them back to you. If we wait past that 10 years, sometimes the risk can outweigh the benefits.
okay. Okay.
Trying to think of what else we talked
I
about.
know.
That might be.
We talked about.
We talked a lot, but
we talked about like what's trying to like get the
most
two
of it.
conversations here, you guys. So I do want to allude that Amy opened up this practice on her site, and she does one-on-one care, you guys, for an hour. So it's a really holistic, comprehensive, with your personal health journey with the questionnaire, and how often you get to sit down one-on-one with a healthcare provider. She does not take insurance, but
I provide the documentation for you to submit to your insurance company, but since I'm a solo practice, I don't do the filing with your insurance company, but you'll have the documentation where you can file it. And I tell everybody, unless you've met your deductible, your insurance company doesn't pay for any medical bill. They should still apply it towards your deductible, but it doesn't, they're not going to send you a check back in the mail unless you've met your deductible.
Yeah. But it's well worth it. But we talked about some of the myths and misconceptions. We talked about who's a candidate. For me personally, this was a game changer for me. I wish I would have got on it sooner, but I didn't know what I didn't know. And I think I was kind of like from that generation that was a little bit afraid about, I had a couple of friends that had breast cancer that was linked, but they were on estrogen only with the hormone replacement, and maybe not the right type, but feeling a little bit apprehensive. But it helped out with my joint pain and my sleep and my hot flashes and my anxiety, and it was really life-changing for me. But Amy is that...
And Lori is, we should give you credit too, without violating HIPAA. She is the queen at doing the diet and the exercise and the sleep hygiene and all of the lifestyle things, which I think, I don't want anyone to think a hormone's the magic pill and going to take care of everything. I think it takes work on our part too, because as we age, our bodies act differently. Our cortisol levels are different. We need to make sure we're fueling our body appropriately. We talk about all these things if you do a consult, but Lori has mastered I can't remember your sleep, but in terms of lifestyle with her diet and with her physical activity and incorporating interval training.
You were helpful with that, because when I came to you, you eat really clean, but your protein intake is crap. You didn't say crap. But the two biggest changes that I made with the hormone replacement therapy, protein intake was huge for me. I made a diary. I was like really, and my husband was like, he was giving me my protein the minute I got back from working out. I had protein before I went to work out. I feel like I have protein coffee now. I have all the things, but that was instrumental in doing high intensity interval training, because, and I've shared this early on the video, just getting that little menopause down here and putting on body fat. And you and I talked about I really thought I was going to go through peri-menopause with minimal problems, because felt like I ate well and I worked out. I was doing the weightlifting until, I don't know, it just seemed like 6 months ago my body went to heck in a basket.
Yeah.
And I'm a physical therapist, and I had chronic low back pain, and I actually quit running for a while, and I thought it was due to taking care of my 80-pound dog that had cancer and had hip surgery. And I do all the things that I knew how to do, and it got 80% better. I went on hormone replacement therapy, and it like went away. And I'm just like, well, I probably needed a combination of the both. But anyway,
Yeah.
It's really a hard season because you have to be so proactive with your health. And I was just thinking last week, I'm like, I don't want to work so darn hard in my 55 years of life, but it's a lot of hard work. But
it's worth it if you, and never feel overwhelmed like it's too hard. I can't do all the things. When I see you, we talk about your individual case, and I might just have you change one thing and we build from there. And so she's doing all the things. Not everyone's doing all the things. But we can all make little changes that, in addition, plus or minus the hormones, you will feel better this phase of life.
Well, and the hormone replacement, I mean, it helps out because estrogen, you guys, affects, your serotonin, which is a neurotransmitter in your brain. And your serotonin is responsible for melatonin, which helps us to sleep. And serotonin is really important for your mood and motivation. And so anyway, I think it's something everyone should consider. I love her concept of the one-on-one care for an hour. It's comprehensive. It's worth every dime. You're worth that dime. And you can get a hold of Amy at mymenopause.com is her website, or if you Google My Menopause, she's here in the Lincoln, Nebraska area. And I think just having a healthcare provider that specializes in this, I mean, we really need more. But I really appreciate you, identifying it with your own journey and seeing a need out for the community and how you're empowering and helping women. And I just appreciate your time today to do this twice, you guys. And she's very busy. So I really appreciate your time. We got to get her back to work. Thanks for joining us. If you guys have any questions, let me know. I can forward Amy's information where she can help you out. Have a great day. Thanks for tuning in.